Michelle, welcome to the program.
Thanks, Matt. Glad to be here.
Well, I'm so pleased to be interviewing you today because, I think it was a year or two ago now when we started talking. You really opened my eyes to more of the charitable efforts that are going on in our ophthalmic community. I really do have to credit you for that. I'm really grateful and looking forward to talking about this great subject of avoidable blindness today with you.
Yeah, thank you. No, it is. It's working with in the advocacy space is a journey, and you're always learning and opening your eyes to new opportunities in the way that you can make a difference. And this is exciting for me as well to be here and talk about this.
Because again, you opened my eyes to this. What would you say to other people in the field who maybe are on the commercial side of things? Why is it important to try to do advocacy or be receptive to community outreach in our area?
To really understand advocacy is really understanding that you can make a difference, that it is up to every individual person and the collective community to look at an issue and a topic and try to unpack it and really educate others and empower others and engage others, the real decision makers that can do something about this. And then by doing that and working together as a community with a collective voice, we can actually see a shift in how care is delivered and ultimately the outcomes that patients are receiving.
Well, it's interesting because, certainly there are many top executives within our field that are very well respected, but I suppose if you're an advocate on any level for a cause, you're able to influence, reach those decision makers, to try to influence them on whatever agenda you have in that regard. So is this an opportunity also for young people who might be, just kind of entrants into our field to make a difference?
Absolutely. Young ophthalmologists, it's really important that they understand that care and when you're looking at a condition and treatment and you're just looking at the eye, you're missing a little bit of the bigger picture. That it's really about a holistic view of the patient, but also the ecosystem within which that patient and you operate. So if you want the best outcomes, it's not just the eye and just the treatment or intervention. It's really about shaping that ecosystem so you can maximize efficiencies and opportunities and really make for a better outcome overall.
I've been to so many conferences worldwide in our eye care community, and we're always talking about new innovations, new surgical procedures, new therapies, but sometimes the message of access to that care worldwide gets lost. I don't know if there's any way to change that. What do you think about all of that?
Access is a critical aspect of delivering care. And I think this happens at the government level. This is something the UN and the WHO can argue for: equitable access to safe, effective medicines or interventions. Sometimes people don't have access to just screening to see if they have a condition.
Well, it does seem complex because in some countries you have the technology, but not the doctors, not sufficient doctors. In other countries, you've got sufficient doctors, not the technology. How do you solve that equation? It sounds like you do need government support, probably investment into education, relationships with other countries to provide certain technologies, whatever it is. But I could see that being needing to be kind of a high level discussion.
The way I look at avoidable blindness, it's the hope that the sheer fact that the advancements in medicines has turned certain conditions that previously you could have lost vision, had vision impairment or blindness, but this is no longer the case because the interventions are available. But to be successful in utilizing those interventions, the governments really need to have eye health as an integrated and integral part of their eye health plan. Now, to do that, you need accountability. And this accountability is what comes from the UN and the WHO, who set these targets. And some of the targets could be, how many eye health workers do you have in your country that are performing cataract surgery, for example? But then we also, I think there's an individual aspect too, that we all have to be accountable as well for our eye health and ensure that we're getting our eyes tested.
Well, before I forget, you mentioned being so involved in that photo competition. Is there any photo that you recall from that competition that is important to you?
So we, Bayer and IAPB, really started to think, how can we get the message out about the amazing work that organizations are doing around the world to deliver eye care services, and also highlight the challenges that they face. And that was really the ethos behind this concept of the photo competition around World Sight Days. And there was one image I remember, and so close to my heart. It was a village, and they were in a village next to a hut, and they were standing knee deep in water. And there was a boy about 10, 12 years old getting his eyes checked by an eye healthcare worker. And it just captured that they're standing in knee deep water and making still the efforts to ensure that eye health is a priority and it's delivered to those in the most remote of areas. And to me, that just spoke 1,000 words that we need to keep this competition going. We need, because it's not a competition, it's a celebration at the end.
Yeah.
All of these efforts and raising awareness. And it just struck home. And we've been going, I think we're in the 8th year since then.
That's great. Well, I think at this time I want to put one other photo up on the screen. It was from last year's competition. I'm curious about your reaction and also the backstory to this one. So let me just share the screen. I think one of our producers may have gone out of the room, but she's bringing it up here. So it's this first one. I think this was one of the winners from what I remember last year, and it is a very powerful photo. Tell me what you know about this.
Yeah, I do believe, I mean, it is powerful because for me, it was what you see in the ability to see. It's really that lifting of the veil that the cataract uncovers and seeing again and being able to have that hope that, it's great. I can actually now kind of look towards the rest of the forward of my life. I have actually a personal story around this aspect and the fear of cataract surgery. When I was in Durban, South Africa, going to an Congress there, and I was presenting around advocacy, and I had a taxi driver. His name was Nathaniel. Yeah. And he happened to always be outside of the hotel when I was getting ready to leave, and he would end up taking me to the Congress. And on the last day, he actually asked me, are you an eye health expert? Are you a doctor? And I said, no, but I do know a little bit about eye health. Why? And he said he had double cataracts. He had cataracts in both eyes. Now he's been driving me in Durban with 2 cataracts. I was like, okay. But he was afraid to get the surgery. Oh. He didn't want to have the surgery because he thought in his mind, and what his friends had told him, is that the surgery requires the doctor to take your eyeball out of its socket to remove the cataract and then put the eyeball back in. Now, I was quite shocked when I heard this, and I ended up spending 20 minutes with him in the taxi explaining this is not the case and that how the surgery should go and such. And he was just so thankful for that time that he could understand that it's not going to jeopardize his livelihood, his ability to drive. That was his big concern. So he said, now I'm going to do this. I'm going to get my surgery. Thank you. And we hugged at the end, and it was great. I went in, I changed my whole presentation and actually talked about Nathaniel and about the importance of taking that step forward to really explain to patients what will happen so they're comfortable and confident, and then they can have this reaction.
Well, I hope he gave you a tip instead of the other way around, Michelle.
I think it was mutually beneficial for both of us because that story really has stayed with me. And that was around 2015. And stories like that and meeting people like that, that's what empowers us. That's what makes us passionate to continue.
Well, we've often heard of this, kind of aha vision moment in different types of surgeries in our field. It happens after LASIK. As you mentioned, it can happen after cataract surgery. I suppose in retina, maybe it's not quite as immediately apparent after, for example, an anti-VEGF treatment. But the thing that I think is interesting nowadays is that, in the early 2000s and earlier, with anti-VEGF treatments, you were really just trying to stop the regression of vision, where now you're getting patients who are gaining lines. And I wonder what that must be like to slowly gain vision. And it must be quite an experience as well.
Yes, I agree. And I think this is, again, goes back into that, the art of communicating with your patients. I think
Yeah.
it's about setting realistic expectations that in some cases you might have a sudden vision gain within the first, first treatment, 2 treatments. You can see it, but sometimes it's not so visual and it
Hmm.
comes over time. And so don't get frustrated that you're not seeing those, immediate, everybody wants the immediate return, right? And so
Yeah.
you need to really manage those expectations, but also manage the expectations over time. So I think that if we set out and really have conversations with our patients at time of diagnosis about what's most important to them that requires their eyesight. So you give them, is it reading? Is it cooking? For me, cooking is so important. With my husband as a chef, so everything we do is in the kitchen. That would be my, I want to continue to be able to cook. Is it your grandchildren or playing golf? Finding those very tangible things and allowing them to remember that that's really important. And in a year from now, they can still be able to do that. So they might not be at the top of the 20/20 vision, but they can still do the things that are important and matter to them. And I think that's a great motivator beyond just saying, oh, well, your fluid is gone, or, this is what your OCT exam looks like, which is very abstract and it's not a tangible connection. So I think,
Yeah.
that's an important aspect, I think, in communicating with patients.
Michelle, I was just planning on doing an interview for our audience today, but here I've come away learning so much once again. So thank you so much for joining us and imparting all this wonderful wisdom.
Yeah, no, not a problem. And it's really a pleasure for me to be here. And like I said, advocacy is a journey that we're learning every single day. And it's really about just engaging with others to hear their experiences and perspectives and really trying to think in a bigger way and not just a narrow kind of, I need this today, right now. So I really encourage all the listeners, to empower advocacy. For this World Sight Day, love your eyes and get your eyes tested. You might be the expert that's delivering the care. You might be the advocate that's calling on the care, but make sure you get your own care and get your eyes tested.